our next discussion. And in this session, it's titled Decentralized Clinical Trials, How Flying Study Nurses Impact Trial Success. So let's talk about the innovative approaches and a transformative way that conducts trials, making them more accessible and efficient. So please help me welcome to the stage Mr. Florian, and let's give him a round of applause.
My name is Florian Schnabel. I'm the CEO and co-founder of Invisio, and we are supporting clinical trials with flying study nurses all over Europe. I founded Invisio in 2011, and after 13 years, I'm happy to be here and to be able to present what we are doing in clinical trials. Great, we have a presentation. So today I want to talk about decentralized clinical trials and how flying study nurses can impact the trial success. As I already told you, I'm the CEO of Invisio. We are located in Mannheim, Germany, and we have a second office in Berlin as well. So decentralized clinical trials are revolutionizing the healthcare and bringing medical research directly to the patient's home. And with our flying study nurses, we can play a vital role in this process and provide personalized care and ensure the success of these groundbreaking trials. So let's talk about the rise of decentralized clinical trials first. So the clinical trial landscape is undergoing currently a transformation within the decentralized approach, and it's gaining momentum to address all the limitations of the traditional models. We will have a more patient-centric approach with the decentralized trials prioritizing the needs and the convenience of the patients, bringing the healthcare directly to the patient's home and into their communities. And we can also address the technological advancement with more digitalization, even at the patient's home. We had some examples yesterday of how we can do the remote patient monitoring and the data collection at the patient's home with real-time analysis, and we can drive this with the rise of the decentralized trials. This approach to the decentralized trials is going to shift the focus from the traditional site-based trials to the more patient-centric model, and these DCTs, as it is called, can completely do all the study activities remotely. So we can go to the patient's home, we can do all the blood work at the patient's home and release them from the burden to go to the site if they are not able to do so. But what are the challenges of the traditional trials right now that we have done for so many years in the past? One crucial part is the patient recruitment. So the traditional trials struggle to find enough or the eligible participants for their trials. Just to give you a rough number, only 5% of eligible patients are included into these clinical trials. Secondly, we have the geographic barriers. Patients often live very far from a trial site, making frequent visits in person logistically really difficult and burdensome to the patients. So when you're really sick and you need to go to a trial site for 17 visits to be a part of this trial, this might be a hurdle for you. The other thing is the high dropout rates due to the inconvenience of traveling. So you might go into the trial, you have 20 visits, you do the first 7 ones, but you're in a car for an hour for every visit. Then it will be hard for you to stay compliant and have this high patient retention rates. And another thing is the data quality. You have a lot of visits. The data must be collected in real time, and with all the struggles that come into the trial sites with not enough personnel to do so, this has a huge impact on the data quality as well. But what are the benefits of the decentralized trials? We have the improved patient access. So decentralized trials give the patient the comfort to stay at home, to have the nurse coming to their homes, and so we have the increasing accessibility and the reduced stress on burden of travel. We have a faster recruitment time because we can search for the eligible patients not just on the trial site, but we can also go to all clinics that are around that site and maybe have the right patient and can refer to the trial site and then include them in the trial. We are saving a lot of costs. Eliminating the expenses from the trial site for the infrastructure and maybe for personnel. We come to new expenses for travel, for the nurses to go to the patient, but it's very much cost saving in the end because for every day your trial is a little bit longer and you are later on the market. It's around 800,000 to 2.5 million euros for every day you are late on the market. We have real-time data, so the nurses at the patient's home can continuously put in data into all the eCRFs or other CRFs provided by the sponsor. We have real-time insights and can make fast decisions on the patient's life and on the ongoing of the trial. But what is the role of the flying study nurses? They play the crucial role in the success of these decentralized trials. They provide the patient-centric care by bringing the trial directly to the home, enabling the real data collection, and through these frequent in-person interaction, assessments and monitoring. And our nurses are the real backbone of the study. They are the success of the study. They're coordinating everything with the patient, with the trial site, and they're in this strong patient engagement. What have we done in 2023? And these are just some rough numbers to give you an estimate what we are doing in Europe. I did not account every visit, so we have around 3,000 plus visits in 2023 with over 899 individual patients. So some patients on like really rare diseases only have like maybe 1 or 2 visits. Other patients had up to 20 visits, so it really depends on the phase of the trial and the complexity. We're currently serving over 25 countries in Europe, and for the future, we are expanding to the last 2 European countries, and the next step for us will be the UAE or Saudi Arabia. Let's talk about the patient recruitment and the engagement, because this is one of the crucial parts that the nurses can support. We can have a more targeted outreach. So the nurses can leverage their local connections. They might be living near to the trial site, but they also know all the doctors around the trial site. So they can go give out flyers to these doctors because they might have the right patient. Who doesn't know about this trial? Who doesn't know that the site is conducting a trial he might be fit for? We have the personalized approach. The nurse is visiting the patient at home in their safe space. They can build a trust to the nurse, and they will. And it's often like a very different trust than they have to their doctor. So the nurse comes to your home. She has time to talk to you. She has time to observe. And we had some really funny stories in the past when the doctor told the nurse everything's fine, he's good. The nurse comes home to the patient, and the patient wife is like, okay, tell her she's not the doctor. And he opens up his shirt. The whole back is red, and he has some problems, but he was afraid to tell the doctor because the doctor never has time and is always in a rush. So we have this personalized approach and can support the patient a lot better at home. And yeah, through this ongoing support, the nurse will have a close connection to the patient. Over the time, the patient will be more compliant, and we have a really high patient retention rate on these trials. Let's go to consistent patient monitoring and care. As I already talked about the personalized attention, the one-on-one attention for the patient in their own homes, gives this high level of security for the patient as well. But also we can have a remote access. So we can connect the doctor with the nurse to the patient. So in some cases, like in Sweden, it's always a long way to travel to a patient because the right patient tends to live like 6 hours away from the trial site. So we can send the nurse to the patient. She can be on a call with the doctor, and the nurse can be the hands-on for the doctor who's still in the trial site. So we can have this remote access. They can track the symptoms. They can react to anything that happens at the patient's home, and they can decide if there's an AE or an SAE and react and bring the patient to the trial site if needed, but we can still get the burden of not traveling to the site from the patient. We try to have the continuity of care, so the same nurse will care of this one patient over the whole trial. We have a backup system in place for every emergency that can occur. Your car crashes down in the morning, your kid is sick, you cannot go, so we will always have a backup solution. But it's our goal to have the continuity and always the same nurse for the patient. And we can also react very quickly to immediate interventions, like for unscheduled visits. The patient is calling, I need a visit, I'm feeling sick, and I don't want to go to the site, or I'm just not able to go to the site. We can send out the nurse immediately, coordinate with our clinical team inside, and have the patient treated at home, or have the patient on the televisit then with a doctor and make a quick decision if he needs to go to the hospital or if he can stay at home. For the real-time data and data collection and analysis at home you can take up to 10,000 metrics. It's not only blood, it's maybe walking pace, it's quality of life questionnaires that the nurse can help support in filling out. We have a 95% accuracy on these analysis and on the data collection, and you only have a latency of around 5 minutes. So if we can enter it into your digital system, you can see it immediately. If the sponsors, like in the USA, the patient is in Sweden, they will have their data immediately. We also have a 24/7 availability, so if you have like the strong need to see a patient at 3 a.m. in the morning, this is possible. Sometimes they're on a tight schedule for medication, and this needs to be monitored like in every 8 hours or every 6 hours. We can be there at any moment. But in the end, what's the impact on the trial success and what are the outcomes? So we can increase the patient recruitment by up to 30%, and it's crucial to have this in the first 12 months of the trial, so you don't lose too much time in the end, because as I already told you, that's the last days of the trial that make you the money or lose you a lot of money if you're late on the market and maybe a competitor is a lot faster. We have a higher patient retention rate that's 15 to 20% higher than on traditional trials, and we have a very high data quality with a reduction in missing data by 25%, and we are very proud that we also had monitoring visits with 0 queries in the past, and the monitor was not able to fill out his report because he never had 0 queries at the trial site, and was funny to see that they don't have a form for that. The time of completion to these trials can be reduced by up to 20% on average. So if it's planned for a 4-year trial, we can reduce that by 20%, and this will save the sponsor a lot of money over this time. And these improvements translate to a faster, more successful trials and deliver therapies to the patient in need for more efficiency. And I think this is the future for the clinical trials to decentralize more, powered with flying study nurses at the patient's home, and this is how we can accelerate the drug development and drive the breakthroughs in global health outcomes. If you have any further questions, you can reach me on LinkedIn or go to our website, invisio.eu, and you will find someone from our project management team who's always happy to help. Thank you so much.